Transparency is a priority for HDR UK and also the members of the UK Health Research Alliance, because transparency helps to both make it easier for researchers to know how to access data and how to apply for the data that they need for their research project, but it also helps show the public how their data is being used and for what purpose. This project's brought together the data custodians on the one hand and the members of the public on the other hand, and driven all the way through to creation of the standards and then being able to fund the adoption of the standards. And we're hearing today from some of those projects who've been able to deliver really important improvements in transparency.
Our funding was focused on all 6 areas of the transparency standards. Our main focus, though, was around making governance and permissions processes more transparent for both researchers and the public to understand. We all know that we need to do this, but the challenge is actually having that dedicated space and time to do it and the dedicated resource.
This funding has been fantastic because it's given us that breathing space to really think about how to meaningfully put public members in the heart of a very technical data access committee.
How can the public be sure that if their data are going to be used, it'll be used in the right way and for the right purpose? One definition of good data governance is that it should be transparent, should be accountable, and it should involve the public.
Recent history has demonstrated that trust in data, how it's collected, how it's used, who uses it, who has access to it, is a massive issue for the British public. There is a clear need for trust, and of course, trust necessitates transparency.
Probably the biggest problem is how to explain something very complicated in a way that really is clear and empowers patients and the public in their knowledge and their confidence.
Emphasis on transparency is incredibly important. The standards approach allows us to be consistent and clear and speak with one common voice.
This is all about building trust of members of the public and also making it easier for researchers looking to access data to find the data that they need.
For researchers, I think the critical thing that we've done is make a very complicated process very easy. And for our public members, they now can very clearly see how rigorous the research has to be.
I think when data access processes aren't transparent, it drives fear and misunderstanding. So transparency is one part of what helps to drive public trust in research and make data available to researchers who are really looking to make transformative improvements to the healthcare.
It allows researchers to feel more confident. It empowers the public to be involved because it's not a mystery anymore. It fulfills so many of the kind of ethical obligations that we have when facilitating this kind of research.
We want to establish today what good looks like. We want to publish that so the whole community can learn. And then we want to work together through the Alliance in partnership with our funders, the Medical Research Council, to think about the next steps and to implement better, more transparent processes across the system.
I think the future's bright. For one thing, we've learned at HQIP through the work we did with this funding that learning how to engage public in your work benefits the whole organisation. And I think with the transparency standards, we can use those to really raise the profile of the value of data and continue to really speak clearly to the audience that are probably the most important audience that we communicate with.